I'm presenting today with Dr. Sandy Spoelstra as the chair of SCC. We've had some conversations there about if design thinking might be the process we use as we work on the performance evaluation plan for the College of Nursing. I've had a little bit of training related to it. I've gone to the FTLC Faculty Immersion. It's a 2-day course in the summer, and now I'm part of the FTLC learning community. However, I'm by no means an expert, and some of you have probably had as much or even more training and education. Who's been to formal education or training here? Yeah, I know, Laura, you went to like a whole week, I think, didn't you? Okay, good. I know some of you have had other exposure other places, so please, this is meant to be interactive, so please jump right in if you have something to contribute. We're proposing, even considering it, because we're finding it, as we're starting to apply some of the methods and techniques at SEC, we're finding it to be pretty simple, usable, understandable, and it still has a process. And as we work through this, you'll see it's not just, well, anything goes. There are phases. There's some structure to it as well. I've written a couple of key terms up here that are really just the hallmarks of it: human-centered and cultural humility. Okay, trying to learn everything we can about another's viewpoint. And then this is the key mantra: absorb wildly different thoughts than your own. I'm going to talk a little bit about the history and a little bit about the definition that Grand Valley's adopted. And then Sandy's going to walk us through a couple of exercises so you can start to see how we might apply it here at KCON. The history is a little fuzzy nationally. It's not like there's a designated mother or father of design thinking, but you can see sort of the evolution of it. It started with the Industrial Revolution. In the 60s and to the 2000s is where we started to talk about human-computer interaction. That's where I live, in clinical informatics. And that's where we started to realize that you couldn't just take an IBM computer, put it on the top of a desk, and people would just love it. So out of the 80s came the technology acceptance model, which is now very widely tested, not originally used in healthcare, but adopted over time. And part of the point of that was to try to understand the person view of it. I think that design thinking takes it even a step further and starts to go into what we've seen more in the 2000s, which is the user experience. I mentioned it was hazy. It did start with participatory design. And we've kind of gone from participatory design to including the users in testing. If I think again of my journey in informatics, we do include them in testing. Then we started to talk about customer experience, and this is no criticism of that book, but that's when we got the book that talked about if you ran your hospital like Disney World, what might that look like? So we were still sort of looking at those we interact with as customers. Human-centered design, we talked about end user. The pitfalls are on here. I know you can't read everything on the slide, but they'll be posted for you. I'll highlight one of the pitfalls of participatory design. Kind of the thinking there was, okay, tell me what you really feel about it, but tell me that you like it. And that, I think, is the big difference that I see with what I'm used to even in clinical informatics and design thinking. We're going to talk about prototype and testing in design thinking. And the testing in design thinking is we want people to break it. We almost want it to fail. There's got to be something wrong, so you find that. I think when we've talked about testing and participation in the past, it's a little bit more like, try it and tell me it works, okay, and we'll move on. So really, again, so much human-centered, really going back to that co-creator. This is a little bit about the journey at Grand Valley. It actually started here about 3 years ago. Grand Valley's embarked on it because as a university, we want to understand the experience, again, have interdisciplinary and integrative problem solving. It does provide a framework. I mentioned that. At Grand Valley, we have something called the Design Thinking Academy. Were any of you aware of that? Yeah, some of you were. Great. It's primarily focused on students. I mentioned, though, that there are also many opportunities for faculty. Provost Davis brought in John Berry, who I don't recall where, but he was from industry and an expert in design thinking. He was here as a visiting faculty for however long you can be here as a visiting faculty. I think that time is up now. So then, of course, the question was, where will Provost Chimatilli land on this? And the word that we're getting is that definitely she still supports that. FTLC is still planning events around that. My FTLC learning community, we've talked about this, and that activity has been renewed for January. I participated through the fall, and I'll be participating again in January. So I think this is not flavor of the month here or the year at Grand Valley. This is a process that we're really we're starting to embed in our culture and will continue to do so. So a little bit about what is it. Before we get into that, I've mentioned already human-centered and cultural humility. And from a nursing perspective, I think it really aligns with where we're trying to go. You know, in healthcare, we've always had the conversation about patient as participant. In informatics, we think they participate in their care. We have a lively conversation about who owns the electronic health record. And as nurses, we say they do. It's their data. And I think more and more as nurses, we're talking about them as partners. Not that we pull them in to participate or include them, but they're really partners in owning their health care. So I think it aligns with where we're going philosophically as nurses as well. Stanford has been really a leader. I mentioned there was not a mother or father of design thinking, but there have been some thought leaders nationally. And Stanford is one of those schools. They have a design thinking school that's this. Small d and then just school. And if you Google that, they have all sorts of materials on this website. They've identified the phases that you see on this slide. Emphasize, define, ideate, prototype, and test. There are variations on that theme. This is the book we're using in the FTLC learning community. It's wonderful. Every 2 pages is a method or technique. There's pictures. There's additional reading. They use terms that are a little different than these 5 phases. I think it's semantics. In my journey as a novice, I think it's mostly semantics, and that's what we're hearing at the learning community. These are the phases that Grand Valley's adopted, and they're the same that Stanford used. So a little bit more about the phases. Empathy, I've already mentioned that that's really the core. We observe, we engage in conversation, we listen, we have cultural humility. We really try to understand. Define is where we start to look for themes and kind of convergent ideas. And then ideate is where we brainstorm, and we want wild ideas. Think of the craziest thing you can think of, and let's explore it and see where that takes us. I really like prototype and testing. I wouldn't consider myself a huge risk taker. I like to try new things, but I'm not a huge risk taker necessarily. And so for those of you who are going, this is fabulous, think wild thoughts, but we're educating students who need to take NCLEX certification exams and other things, I think the prototype and test is sort of that safety net, right? We do it with a smaller group of people rather than across all of our student body. So for prototyping and testing, you prototype like you know what you're doing. Okay, we build, we know what we're doing. But we test like we don't. And when we go to the end users, the testers, we want them to tell us what didn't work, what can be improved. We almost expect them to break it for us. The phases are completely iterative, and I would suggest, although the slide shows that so well, that there's probably even more circles going back. It's not a linear process. You don't start from, it's not like developing a product on an assembly line. You don't go from empathize to test in that straight line. You're going to always be going back based on feedback, based on maybe new brainstorming, based on new empathy. So we've talked about the 5 key phases. These are some other key principles about design thinking. One is visual. It's communication. You communicate visually. When I took my course this summer, we talked about how to encourage creativity across the university and co-create that creativity with faculty and students. So we talked about, space. If faculty are in offices, does that lend itself to creativity? So we had little shoe boxes and, pipe cleaners and cotton balls, and we designed little spaces where students and faculty could interact. So you actually get your hands dirty, so to speak. You actually do create visually. This says tell good stories. We're going to go back to that. That's often a hallmark of this. We talk about storytelling. We talk about know. Okay? This is the design thinking concept of storytelling. We want to know the backstory. And when you empathize and you interview people, when I did the immersion this summer, we had students come in and we interviewed them. And so we're interested in their backstory. We interviewed each other. Grow. What are they trying to achieve? Okay? What's their challenge? And so as you talk to people, our students, what's their challenge? And then show, and that's again the visual concept. Show me. Human values, we've talked about that quite a bit. The cultural humility, very heightened awareness of other people's needs, their values. Craft clarity. So this is what I really like about design thinking, because we're going to have wildly different ideas, but it's still somewhat within a structure, and it's making some sense out of problems that are messy. Who amongst you thinks we have messy problems in healthcare? Yeah, right. I mean, it's just all very messy. So my learning community, where we are all in healthcare to some extent, we did the cognitive walkthrough method and technique. And we did it as though we were taking students into a primary care office for the first time and trying to help them make sense of the registration process. We have a registration person in our group. So how do you make sense of that onboarding person when they're walking in, and there might be an iPad, there might be a person, they might need insurance, we have them sit back down somewhere we try to teach. So we used the cognitive walkthrough, and it worked very well. It helped us to make sense of kind of that messy problem of entering a primary care office for the first time. Embrace experimenting, we talked about that, the prototype. It's to learn, to think. Be mindful of the process. So when you're in the phases and you're thinking about different techniques and methods, this goes back to a little the structure, a little the science around this. Always keep in mind the goal. And then some methods and techniques lend themselves better to different phases. So try to know what phase are you in. In our work at SEC around the Centers of Distinction, we've used some of these. The brainstorming we've had you do, for instance. The idea of prototyping. Those are all design thinking methods or techniques. And so we've tried to be mindful of, is that the right activity to have faculty do? And so far we think it is. When we had you brainstorm, we got exactly the kind of information we were hoping to get back from you. Bias towards action. I really appreciated the dean's support around the Center of Distinction work. As I've met with her, she has said, let's just do it, Marie. Let's just try. Let's try one Center of Distinction. We're not going to go with all 4. We had excellent discussion this morning, even around the activity that Grace led. You came with thoughtful questions, right? So we're not going to try to answer those questions across 4 centers of distinction, but we can try to answer it across 1, and we still move. And then radical collaboration. Sometimes it's good, even when you're pulling together your design thinking team, to have someone who knows nothing about the process. And that's where sort of that radical collaboration comes in. They may ask questions, we're so used to it. They may ask questions and say, why do you do that? I've never seen that done this way. I think we've gotten more savvy about asking here at KCON our students. We ask their input. I think in the healthcare settings, they're more accustomed now to asking patients, clients, participants. But still, it's more than just asking them. It's engaging them as co-creators and sometimes asking someone who's not familiar, who can wonder why we're doing things the way we're doing them. Questions or comments about that overview and sort of the definition? Diane.
Oops, can you go back one? Could you...
I can repeat that question.
Yes, please. Thank you.
So the question was, I'll first ask the question, then we'll let Dr. Terry answer. So the question was regarding the science, do we have some reading we would recommend? Dr. Terry?
Could you pause for 1 second because we're videotaping? There. You get the ice cream cone.
Okay, this is design thinking.
Yep.
Design thinking is part of an initiative that's happening in Grand Valley, and if you go into do design thinking in Grand Valley, you'll get open to a page, and there's a whole number of resources. There's some videos, about 4 videos in there, as well as some reading videos and literature. So that's where you want to go. Okay.
Thank you for that, Jerry. And also, part of the reason we're doing this today is to get a sense from our faculty peers how you feel about design thinking, and if at SEC, as we work on the PEP, Program Evaluation Plan, should we consider using some of these techniques and methods to keep updating that and improving that. And if that's the case, then we were expecting out of SEC that we would start to maybe even look at some books, share some readings and things. Thank you for that. Dr. Spoelstra?
So I loved the question about does this have an evidence base, because that's one of my picky things. Like, I don't do anything anymore that doesn't have an evidence base. And even when you look at something like PDSA, Plan, Do, Study Act, that's been around forever, it doesn't have a lot of evidence around it in comparison to design thinking, where it does have a large base of evidence to support it. So almost 2 years ago now, the SEC committee brought to the FOC committee a motion to request that we use PDSA as our process for program evaluation here in KCON, because prior to that I couldn't find that it was in the minutes anywhere that a formal evidence-based process was selected and formally chosen by the faculty who govern how we go about doing things. So since that time, it really hasn't had any uptake and not being used as a process. And really, if you think about it, like what Marie was saying a second ago, is that Grand Valley's pretty much adopted design thinking as an approach. And I think my understanding, because I didn't have the luxury of going to the week-long training because of competing time, but I did go to the Design Thinking Leaders Group, and Nancy Schuss was there with Carrie Smucker. And I think there's a strong intention to embed this within how we go about teaching. So we facilitate students learning the process by role modeling design thinking, so then when they get out into the work world, they'll have this as one of their skill sets. So at that meeting, since you all know me, I raised my hand and I said, well, wouldn't this be a good approach for scholarship for people when they're going through their promotion and tenure annual review to use design thinking? Then the faculty would better understand how to apply that in the classroom. And so I think that question kind of startled everyone that was there, but they're starting to think about that now at the Pew FTLC. So they're actually thinking about not only in teaching, but in scholarship. So when I think about it, it's very similar to both the QI and research process. And I was thinking about the words, and here's the different words we use for, these are the 6 words that come from the Stanford University to describe design thinking. And then on the other side is words that we use, and we teach these to both our undergrads and graduate students to explain what the research process is. And so I was trying to make sure in my mind that it was very similar. And to me it is, except the words are different. And then I looked at QI, because I remember having taught 691 a couple times, that I had to explain word similarities to students so that they understood when you say a research word, it means the same as a QI word. It's just a different word, but in essence it has the same meaning. And so here I was trying to list out the difference between the design thinking concepts and the quality improvement concepts. And so this actually helped me think through this a little bit better. And the one thing I like about the words in red, which are the design thinking words, is they're a lot easier to remember. And they're kind of all in of themselves very clear. I think everyone knows what storytelling is, what prototype is. I think we have a better clarity of understanding of those words than either the research process words or the QI words. And so I found that very interesting just for myself to have gone through that little exercise to prepare for this event today. So we've been trying to figure out how to use this because so far we haven't done the BDSA process very well. And so we've been discussing at SEC if this would be a better approach for us to use when redefining the program evaluation plan and then applying it day to day as we're doing our work. So what I have here are two vague examples that some of us just sat in a room and made up. These aren't real, but like this, and then I have a third one where I'd like to try to apply the process to one of our wicked problems in SEC, which is alumni surveys, because we don't get a response. And it's one of our expectations for accreditation that we collect data on that. So Dr. Jerry Terry's chair of curriculum this year, and she saw this slide, and it's not like we're suggesting in any way this is how to do it. These were just ideas. And the third person besides Marie and I on the team is Carrie Smucker. And Carrie and I both have in our job descriptions evaluation. And so, like I said in the last meeting, we took a hiatus for a short period of time with data compilation, but we really need to get on this soon because, like Dr. Koviak reported, in 2020, we have to do another report for CCNE. Now, I wasn't all concerned about all of the data collection over the last year because we did so well during our last accreditation visit. So I didn't have anything like I was, you know how when you're on a hospital unit and you have something really bad and you follow it? Well, we didn't have any bad. So basically, I wasn't concerned that in 2016 we kind of took a data compilation vacation, we'll call it. And now we have to kick it into high gear and figure out how we're changing our evaluation plan. And we need a process to go about doing that. And also, SEC committee appointed Carrie and I as a one-year task force to float among all the organizing committees to try to help design operational procedures so that when we have transitions in chairs, we can still do it the same way within the department. And then I'll know what my job is, and Carrie will know what her job is, and we'll understand where we're getting data from to compile it for the program evaluation plan. That was a Yahoo over in the corner. So basically, it's just creating the structure. And ours will always be at a minimum a 3-person task force, Carrie and I, and whatever other topic we're working on, or we'll bring in other people depending on what the topic is. We're getting a little bit of a slow start because there's competing demands with the rest of our workload, but we know we're on this important timeline now for the next accreditation report. So here's just an example that we kind of made up sitting in a room just talking about it a little bit. And we have talked with Dr. Jerry Terry a little bit from the curriculum committee. And I think everyone knows one of the big issues for HLC accreditation is the congruence between the SOR and your syllabi. So if we empathize, one of the issues that I personally find, so I'll just talk about myself, and then I'll ask if you have the same problem, is that I can't, we're supposed to every semester look at the SOR. So my problem is I can't locate them. So I wonder if anyone else has that problem. Can you find?
I know where to find them. that we are keeping those updated.
Okay, so that's actually a second problem.
But there have already been changes.
Well, then if there's this, that's different than if there's an SOR there.
So we need to write that down.
The SORs are in, are what we have, like what the university requires, documentation. So if we're drifting in terms of our working syllabus, that's a different problem.
No, and that's not what I'm saying. I'm saying, okay, if you as curriculum committee updated, and I know this has happened, an SOR for a course that goes into the system, did you also update on our L drive in the folder?
Recently did.
Okay.
Dan and I recently reviewed them, but
Okay.
what was going on before that, I can't.
Right, that's the issue, is
Yeah.
are we keeping it up to date? Every time we put in something to the system, do we update our local stuff?
A good thing to put in a procedure, so it's standardized.
I just wanted to point out, this is a great example of empathizing.
It is. We're empathizing. There's no one else here that can't find theirs. I can never remember where to look on the L drive. I'm sorry.
Aren't they in Blackboard? I always just go to the Blackboard side. Are those old or changed?
No, I don't, but they were in Blackboard during the self-study.
Correct.
Time,
They're not there. I went on the other day.
But
Really?
somebody made a change and not updated the
Well, that's what I'm asking
That's
you.
kind of my,
Right, because that was only for accreditation reviewers.
When we did the work for Higher Learning Commission, which is coming soon,
Next year.
and
Yep.
when I was doing the curriculum revision, which of course we've talked about extensively, I saw that different SORs, depending on where I looked, were in different places.
Oh, for the
So
same course.
We don't have, for the same course, we don't have what I would call a single source of truth.
right, that's a problem.
Okay, another reason to have a procedure. Love it.
Sale doesn't, when they create the SOR, when you put it in, there's no date on that. So you can't go back and say,
Ugh.
this document went into sale and it's dated. It is not dated at all. So you can't even go, well, besides you can't, the university loses them too, so that's a whole other story.
Yep. Wow.
Mac users can't always access the L drive.
Oh, Mac users can't always access the L drive. Sometimes on campus too. Yeah. Anything.
Can I just ask a question? My understanding was every time we made a change in the original SOR, it should go through the university.
That's right.
Am I hearing?
That's right.
Well, I can tell
Am
you.
I hearing now that since there are different versions, that we have made changes and it's not gone through?
No. My
Why are there
initial-
different versions?
My initial point is that your committee might put it up into sale, but faculty in general don't access sale. They look for where there was supposed to be a copy
So they
that's
don't know there's
accessible.
been a change.
Correct.
But I can.
If that wasn't updated in our local L drive folder where we're supposed to have them
Okay.
for everybody's access.
I got it. But I can also report in my storytelling that when we went to locate all the SORs from the university, they did not have all the approved ones either when we went through accreditation. So what we had,
We're actually a lot better than most.
so they didn't have what was really approved either in the department here is what I'm saying, on file. That's also a problem. Yep. This is just ripe for design thinking, isn't it? And then the second thing is we have the HLC accreditation coming up and the redo on CCNE. And a lot of what SORs and course review is for is to improve, so faculty can improve a course. And then the associate deans can use them for program improvement. So
I'm sorry, one more point. When we say improve courses, I think only because we have so many new faculty at different stages and how comfortable you are with education, that improving a course may sound like improving andragogy. It may sound like various teaching strategies or different ones. I think that needs to be clarified when we say improve a course. You know, that might mean delivering it differently, but it certainly doesn't mean changing the original SOR. in all cases.
In some cases, it would.
Right.
If you're, in some case, that's the distinction is the syllabus of record is what is the university's official record of the course name, description, objectives, and then approximately how it's going to be evaluated. If you are making course improvements and they do not change your objectives, which are your learning outcomes, then your SOR may not change. But that is something you have to be evaluating in addition to your individual practices on a daily, weekly level, etc. So there is a difference between your syllabus of record and the course syllabi that you hand out to your students. Your working syllabus is the one that gives more meat on the bones of that skeleton.
But they have to be congruent.
Right.
Exactly. So what distinguishes them from undergrad is that you wouldn't take a core course
On your own. You wouldn't take a core course on your own, decide you were going to change the SOR, and then move that through SAIL without first interfacing with your team, with the program itself, because when you look at the way all these courses are set up, they are congruent. They do build on each other. We go according to Bloom's taxonomy. We're addressing the essentials. So it's a very team-delivered approach, which may make us unique from other colleges who have standalone courses and have more ability as a faculty of record to make those choices. But we're a little bit unique in how we look at the program that we offer. And then similarly, any SOR that's going through any kind of a change is really kind of done under the work of the curriculum committee. And so when something goes through, there are faculty that are reviewing that, and then faculty who are teaching are well apprised of a different SOR.
So I'll just sum up because, so basically, number one, if we define what our problem is using the design process, we need to make sure that the dated SOR is on file both in our department and in the university. And secondly, so that I can access it, so I have to be able to remember where it is. And that course reviews are conducted to meet accreditation expectations and in a planned manner. And then courses are improved when needed, ... with whatever Sue said. And then we need to make sure that the SORs are available for us to use when we're writing our syllabi each semester. So then we have to remember where they are and be confident that that location has the most current ones, because you could hear when people were talking, they didn't know if the ones in that one file were the most current ones. And then we need a way for curriculum committee to easily manage this, document the SORs that are dated, have course reviews on their cycle, and improvements if there's any type of issue within a course. And then somehow that has to map also with LIFT, because that's also evaluation of a course. But Carrie and I see that as data triangulation, and we won't talk about that today. It's boring.
Can you see that as curriculum mapping?
I don't think so, because what we would do when we're doing that triangulation of data is we would take, like I'll just say 792 course review and the 792 lift of all the faculty that did it and make sure that it's congruent information.
The PAs have just a huge access template. Susie Rademacher, and she's more than willing to share that. And Glenna Decker, I know, is doing her dissertation on it. And it maybe when I say curriculum mapping, that's too restrictive, because it does include the syllabus of record objectives, as well as the class objectives, as well as what that level in Bloom's taxonomy. So it's an additional, but it helps to stream that. I'm wondering if, as we start looking, that might be something we would incorporate into there.
Yeah, it's really nice because on SEC we have a person from the PA program on our committee. There.
No, I'm talking about PA school. Physician assistant.
Yeah.
Is that what you're talking about? Oh, for goodness sake. So Susie
So the person on our SEC committee reports that's not working. That process for faculty. I don't know. But I think this is where you ideate and you get, this is the next step where you collect all of these ideas and find something that's functional within our department, whether it's an Excel log or Access. So Carrie reports Access is very difficult to use and clunky software. And Excel is improved so much it can do almost everything that Access can do. And then I wouldn't, like I'm trained in Access and I wouldn't have to think, how do I use Access every time I go into it? It's not easy software to use. And see, these are things we would then instill within an operational procedure so that it always carries forward. And then we could use those when new faculty come to understand where the SORs are, for example. And then we need to establish some sort of a way of addressing when a problem comes up in a course, either through a lift or through a course review, so that it's standardized all the time, every single problem that comes up. And that again would be like, what do I mean by that? Would it go to the course, no longer course coordinators? Would it go to the faculty currently teaching the course? Would it go to the associate academic deans?
No, the teaching team is what you were saying.
Whatever, teaching team, yep. It does, and that's why we need different models for different, yep.
When you think about anything from why you take a design thinking approach to a quality improvement approach to a logic model approach, it's usually starting with an issue or an opportunity, either or. And so sometimes, depending on how many resources one has, we can really go into a very innovative approach of design thinking and move through that. Other times we're looking at the quality assurance and the quality improvement. And so I don't really see a one-size-fits-all. I see it being very specific, where we have approaches that we can use and how we collectively address issues, depending on the resources we have available to do it, depending on the number of issues at play and the priority on which issues to address. So I too have been through the immersion training, and I really appreciate it. But I also recognize there are times where there are different approaches that we'll use. So just a thought on that.
So when Carrie thinks about what to prototype immediately within the next 3 months, she's thinking some sort of an Excel, both for SORs and course review. And we have the ability to use SAS software, which is statistical software, to connect the two Excel databases, and possibly designing a template for course improvement, and then setting up a structure. Like Carrie gets sometimes, I'll just say wild when she thinks about the L drive, because it's so unruly and everyone consistently reports they can't use it because they can't find information. And so when she thinks about it, she thinks maybe we should just start a new folder on the L drive and start putting new things into it going forward. I'll just talk about her since she's not here.
So when you say course review, so right away this is kind of where our conversation has been in curriculum, in the curriculum committee. So, you know, everyone's got more than enough to do it on time to duplicate each other's work.
Yes.
So as our committee is looking at how are we doing course review, how are we doing it? How are we looking at it? And we've been checking with other universities on how
Yep.
they do it, yada, yada. What are you saying here, I guess? Clarify what that means.
For PEP, we would compile the data, so we would be able to report
What
84.
What data, Sandy?
Well, if it was in an Excel, we could report 84 courses were reviewed, 60 were old, 24 were new,
What does review mean? I guess that's-
whatever your process is.
Well, that's what.
What outcome or what process you want
That's why we feel like we need an operational procedure so it's more defined, and that's a great place to start by looking at other universities.
But I think your logical point is that when
They do have specific responsibilities, and you will identify things within it that talk to your productivity as it aligns with your charge. And then the work of the Scholarship and Evaluation Committee is to be able to be reporting those outcomes or those measures into
In that dashboard, like I
into
showed
the PEP. It is not. It's not that any one committee owns the PEP. The PEP, with all of its standards, has certain things. So think about standards 1 through 4, and when you were writing for self-study, who was really involved with writing standard 3? Curriculum committee. Who was involved with standard 2? UAAC, GAAC. Who's involved? It doesn't mean that we don't overlap, but what's being suggested is that the governing committees could use a design thinking approach in how it looks at the work that it does and then comes out and has to have some kind of measurables. And that somehow is, as Sandy and Carrie work and others, to be able to get that data. Where will they find it? But it still lives with the work of each governing committee as it aligns with its reporting. Is that how I'm okay?
I think that, just piggybacking off what you said, that this really is intended to be a way to organize the data and assure that courses are being evaluated. Not that the SEC is going to determine what those outcomes are. The curriculum committee is going to determine what they think the outcome needs to be in terms of what the review is, how often it happens, and the PEP only says that curriculum is doing that and then facilitates the way to get to the data.
Right, and so, like, if we go back to empathizing again, sometimes we couldn't figure that out during the last CCNE, so it was a little challenging to compile data because when we'll be on the foci in a second, sometimes we have to map back to the KCON foci, and it's challenging to pull that out of your rubric in an individual course sometimes to demonstrate that a student learned something. And so that sounds a little confusing, but that's basically what the reviewer's expectation was when they were here. You know, because provider of care is one of the items that's listed as a foci in KCON. And I read through lots of course assignments and rubrics to identify where in an assignment faculty were measuring that to demonstrate when people graduated with their BSN or DNP or whatever degree they got out of here, we demonstrated and measured that they could do that.
And I think part of the confusion, at least on my part, was college has three overarching, call them what you want, objectives, outcomes, goals, takeaways, outcomes. But I think we don't necessarily make the connection between those and each of the syllabi.
Correct. Yep.
And we're more directly concerned with assessing or over-assessing or over-evaluating the course objective. So I think we need to kind of look a little bit bigger now. I think I'm at a loss because I'm not quite real clear on this design thinking. I mean, I can think wildly, but I'm not quite sure where the design thinking needs to be. Thank you. So I think part of the disconnect is, you know, the college has the objectives, and then they're pretty big, and then we're trying to fulfill the more.
And all that design thinking or QI does is make a way of going about doing that. It's just an approach of how you go about doing that. Because right away we identified the issue of having some sort of operational procedures for Carrie would help her greatly with her position.
They asked the question, said, what do you need in order to do this? So
Well,
it sounds like you need the correct syllabus of record. It sounds like you need a way that we're looking at courses. In order to get to this, or am I looking at that?
So I'll tell you my stories now, because we were unable to locate all the SORs for the courses that were being delivered either from this department or from the university, and Carol had to dig around in the attic to locate paper SORs. Because even if it was done in 1974, and it was the last one for a course, we had to find that. So that really happened during CCNE. And then at that time, we found some SORs that were not on file at Grand Valley. And everyone knows that's the process. So I don't know if that was because it wasn't documented or the reason behind that, because those committees turn over a lot too.
It was the turnover in the committee and not closing the circle of when the final SOR was approved at the university level, getting it into our electronic.
Exactly, yeah.
That's what it was.
And like one of,
Getting it from the university
yep.
into our system when it's all finalized.
And one of the crazy things is none of those are dated. And I'm sure now, because Carrie and I work very closely with Chris Pluff, that he's going to put that high on his to-do list, because that's a really big problem for him going into HLC. And then I can just tell you my current story is that I got my syllabi all done for one of the courses I'm teaching this semester. And what do? You copy the old stuff first, right? And then you fix it. So I had the old objectives, thinking I'm the queen bee here. And then Dr. Conrad said, well, I think you better go back and look at the SOR, because she was teaching the course with me, and see, because they talked in FOC about how they might need to be the same, and mine were wrong, my objectives on the syllabi. And I'd been using those for, this would have been my third semester. Yeah. I don't know about you, but it's not something I have in my mind queue when I'm setting up courses at the last minute. Yep. So those are my own stories. So does anyone have anything else to add about SORs or course review before we move on to another example? We identified some issues that need to be worked on. Yeah. So one of the problems that I had to also work with, I'll just tell my story first. My story first is during the CCNE accreditation process, we could not find attachments to minutes for a large number of the minutes. And there were also many different ways of taking the minutes, so there was a lot of inconsistency with how they were taken and incongruence. Motions were unclear. Problems were identified, but they weren't followed up on at the next meeting or subsequent meetings. And so those are actually the words told to me in the car when I was driving around some of the reviewers between here and the hotel or where they were going for dinner. And so they tagged specifically the worst committee to be SEC. So, but when you look across all of the minutes, you kind of see there's absolutely no standardization. And so that's one of the first things Carrie and I have started working on, where we have better clarity with actions and motions so that we can see exactly and be able to pull those out and code them from the minutes. So we're testing a template right now. And this is very important. The first person to point this out to us again was Chris Pluff, but we already knew it was an issue with CCNE. And he pointed out there's many departments in the university that don't take minutes. So we're way ahead of that. We have the minutes. We just aren't always sure what they mean, and we didn't do something with them. And then after thinking, we found that really there was no formal transition from chair to chair, chair to chair, or committee members with training. So the first thing was to figure out how to track the motions and actions so we could observe improvements as they were occurring. But to do that, we have to be able to retrieve this information from like 3 or 4 years ago. It's not an easy thing to do. It's not like last month's meeting. So we're thinking we need a consistent method for minute taking with a template, procedure, and then training of the PSS staff who are taking the minutes. And then they're all stored in a similar location on the L drive, clearly labeled all in the same way with attachments. And in our procedure, we'll say no one can move the folder because that's how the things got unattached before. Someone moved folders and then the links broke. So there has to be a rule about how you can't do that. And then this is how the chair meeting came about. Committee chairs trained to manage minute taking because a big part of one of the failures pointed out by the crediting body was that many of our minutes aren't signed by chairs of committees. And then after doing a little bit of a mini deep dive, we found that at a committee meeting, someone could make a motion to fix something in the minutes, and then the PSS would fix it, but a chair would never see it again, and so you don't really know how they fixed it or if the fix was correct or not. So there was this whole loop there kind of missing. So after talking a lot to Chris Pluff and finding no one else in the university was doing this, we designed a minute template and procedure and did talk to the PSS staff already and just met with the committee chairs. And we definitely need to fix the L drive issue on this problem also. SEC committee is currently piloting the template, and our next step would be to try to code the actions so we can pull them out of the data and pull them out. Nurses are wonderful, aren't they? And then we're thinking we have to be able to compile that somehow in Access.
When we went to do this template, did we, you know how we always get focus groups to see what works best, did we get some of the PSS?
We got all of them.
To kind of give ideas of what works, what doesn't work, okay.
That's where we started with them because they're actually the users of them. And now the chairs are looking at it. But we're learning a lot by testing it too in SEC.
Can I have a wild idea? Okay. One of the things that we now are transitioning at KCON Yahoo to more electronic everything. Could we please have a concerted effort, and maybe we need to use this system to do so, or design thinking. Can we figure out how we can have a consistent electronic signature that's official for all the faculty? Because we can't sign them unless it's an official electronic signature. But if there could be a consistent procedure that all of us would have a consistent electronic signature, it could go on every form that we use here at KCON instead of having a written whatever. So just a thought. I don't know what powers. I know there's programs out there, but rather than all of us having a different program, it would be really wonderful if we could have a consistent electronic signature program.
That would save so much time. Wow.
Been made into like a permanent document?
They were not. They were kept in Word format, which is also a problem. They should have been put into PDF so no one could change them. I know. I don't know what. That was what the CCNE people recommended. We actually, Carol has software to go back from PDF to Word. It doesn't work to password. Yeah, we have no way to store all that and retrieve it. It's painful. So this is where we're at with this right now, but it really is important to how committees function and how we document what we're doing for improvement or even just SOR review, all of it. We have to document it. So, one of the things that did come up with minutes, just so you know, is they asked about redacting, and Pat Smith is looking at the Grand Valley going to actually probably end up making a policy because Chris Pluff asked her, because he could see across campus there were so many different ways of keeping minutes. So Carrie and I worked with him to prepare questions for Pat Smith so that we could get that clarified university-wide. Student names, faculty names, whatever. She's looking at the whole thing.
So, in UCC, we do all the minutes when I was on UCC through Google Docs, and updated them, put them on the cloud, and it seemed like it was a very excellent method to use, as well as accomplishing a lot during the meeting. So, has that been thought of or considered?
So Carrie looked at Google Docs already, and it's not someplace where we could put confidential information. It's not secure enough. Correct. She still didn't feel like it was right now because, you have to deal with FERPA. I mean, we had minutes where faculty's or students' health was being discussed. You just can't do that in minutes. That's a HIPAA violation. This is why Chris Pluff suggested this needs to go to Pat Smith, the Grand Valley attorney, for clarification, so that then he could disseminate campus-wide the way that it should be done, not how one committee's just doing it.
The nature of what you're dealing with in UCC is the nature of the data that you're dealing with in UCC is not that level of confidentiality. It's university documents. It's not people's health, student progression, etc.
HIPAA or FERPA. Those are the two biggest concerns, HIPAA and FERPA. Many different committees here deal with many things like that. And so we were going to, in our last 2 minutes, try to problem solve how to collect data on our alumni, because we're required to do 1 and 3 year post-graduation surveys. And like over a course of a year, we would get like 12 responses or 22 responses. And so since we only have 2 minutes left, maybe we could get some wild idea suggestions.
One of the suggestions I would say is to post something on Facebook with a link then to a secure site, because it does seem that when we ask students to volunteer for various things when we use the Facebook page, that does seem to work well.
That's true also. We used it for getting sites for this semester for the DMP students. It was very effective.
I have one suggestion, which would be to link the response to some type of reward, and it doesn't even necessarily have to be something financial like a gift card. I'm thinking even something like access to the university libraries or something like that people might appreciate, maybe something monetary, maybe football tickets, maybe a concert ticket, I don't know, something linked to the university, but that would also be some type of incentive for them to do it.
Yep. So we kind of did that already originally about a year ago, and everyone's having the same problem.
I just think this is a really wicked problem, and everybody struggles with it, and it's hard to track people. It's hard to get them in their busy lives to do it, and it's hard for people to feel responsibility once they graduate that this is important for
She's empathizing.
information. Yeah, well, I've had a lot of experience with this, and it's very
terrible.
very difficult, and not trying to, try lots of different ways to do it, and it's a wicked problem, and it would be nice if we could figure out some kind of universal, creative, wonderful way to get something back.
What we would be doing is bringing in the consumers in this. So we're sitting here trying to solve a problem, but we're on one part of the coin, and so you really would be bringing in either people that have completed them or people that graduated or people that practiced it. And that's what we would do, is you first bring people in and you pose, hey, this is what we're trying to achieve, and you listen, and you listen, and you listen over and over, and then you start to do ideation. So we're hopping into brainstorming, but we haven't done the true design thinking thing, which is get the stakeholders to the table and learn from them and then create.
Yeah, this is just a simulation, but SEC committee has a grad and undergrad on it, and some of the people are also alumni. And so we did do that step, and then Carrie's in the process of testing through the Facebook if people would answer it and how long it takes to answer it. And she's finding 30 seconds or less for, I think, 6 questions. Do you remember, Marie? Yeah. 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 2 last comments, and then I'm apologizing because I'm 3 minutes over.
Have we considered using the mechanism that is being used to invite people to our alumni CEUs? Because that's a regular thing going on now. We're getting invitations that ask us if we want to go to the paying CEUs, and I'm
not sure.
That, I think, might be another way now that that's going and operational.
I definitely wrote that one down. One last comment from anyone.
I spoke with a number of the DMP students over the weekend about this issue, about a lot of issues, but particularly about this issue I was asking them. And they felt that if we hosted some sort of reunion event, that might be a way to get the information as well.
So just so you remember, these are some of our challenges. Sometimes we don't get to doing because we're thinking or meeting about something. And really, this is a culture shift if you use design thinking where you're doing and not meeting about doing it. So it's truly a huge culture shift.
And you say that on a Monday?
Yeah. Bad day, bad day. And we do have to think about how to link back to the agreed upon KCON foci areas, because really the PEP work needs to link back to that in a very structured manner. And then we need to think about how to streamline all these tasks so that it doesn't become a second thing to do, but we could do it within the first thing we're doing, like grading a rubric, reviewing a course, or just common activities that we're already doing, and then we could just compile the data from that. That's kind of the goal that Carrie and I have. It's going to be no extra work. And then we need to think more deeply about how we can facilitate cross-committee collaboration. When we recently had that chair meeting, it was suggested that the chairs bring their goals for the next year so that they could, among the committees, share their goals. And so I think there's a lot of opportunity for a cross-committee collaboration. And then somehow we have to think about how to improve more rapidly. But I think if you shift from meeting about something to doing something, then that would kind of take care of itself. But that's a big culture shift. And we're testing today, because we're doing a quality improvement in our nursing research center. Carol will send out a little bit different looking survey because it has automated CEU certificates so that they don't have to manually be sent out by email anymore. So it'll look a little bit different because we're trying to streamline and do less work. And this is available in the Faculty KCON Connect along with some handouts about design thinking. At the very bottom where the icon is, the last one. All right. Thank you, everybody.